Peter Rhys Evans was born in the English county of Kent in 1948, but went to a boarding school in North Yorkshire called Ampleforth College. He qualified as a doctor from St Bartholomew's Hospital in the City of London in 1971 before teaching anatomy at Bristol University for a few years. He then decided to specialise in the field of otolaryngology, a field better known as ear, nose and throat, or just ENT. Peter built up expertise in plastic and reconstructive surgery in this area before doing a postgraduate degree in head and neck cancer surgery at the University of Paris, during which time he was the resident ENT surgeon at the Gustave Roussy Institute. After 5 years as the main ear, nose and throat consultant at Queen Elizabeth Hospital in Birmingham, Peter was invited to take on the role of Chief of ENT and Head and Neck Surgery at the Royal Marsden in Chelsea. Whilst pioneering practical new techniques of laser and reconstructive surgery and other innovative techniques, Dr. Peter Rhys Evans simultaneously developed a strong academic reputation. He published over 250 scientific papers and is the author of the award-winning key textbook field, Principles and Practice of Head and Neck Surgery and Oncology. After 35 years of dedication, Peter left the NHS in 2016, but continued in private practice. He founded and helped run the Oracle Cancer Trust, the largest UK charity raising funds for head and neck cancer research. Quite early on in that very impressive career, Peter was asked to write a chapter on the paranasal sinuses in the standard ENT textbook at the time. As you'll know, sinuses are basically air-filled spaces in the skull, and the term paranasal indicates that they're placed alongside the nose. Peter wanted to write something new and interesting about the subject from the point of view of evolution. He quickly became puzzled how to reconcile these features with the traditional strong belief at the time in the savanna theory. Like most of us, Peter came across the work of Elaine Morgan and was inspired. He became an early proponent of the Aquatic Ape theory, or Waterside Hypotheses of human evolution, and had a paper published in the Journal of Laryngology and Otology in 1992, The Paranasal Sinuses and Other Enigmas, an Aquatic Evolutionary Theory. I think it was only the 4th paper published in the scientific literature on the subject. Mark Verhagen with 2 and Stephen Cunnane were the only ones to do so before him, as far as I can tell. Peter used his contacts in the medical world to organise a symposium on these themes in London in 2013. The 2-day conference started with a keynote from Sir David Attenborough and included dozens of speakers from both sides of the more aquatic divide, including Donald Johanson, the paleanthropologist most famous for finding the fossil Lucy. Peter, of course, gave the ENT angle to the subject, focusing mainly on the condition of surface ear. The meeting caused quite a stir at the time, especially among those who I label aquaskeptics. For example, Henry G., the chief editor of the prestigious scientific journal Nature, suddenly found it necessary to write an article about the aquatic ape in The Guardian, equating its proponents with creationists. The specialist journal Evolutionary Anthropology, having shied away from the topic for over 50 years, suddenly found the need to publish 2 critical papers in a single issue. Kate Wong, a top journalist at the well-known Scientific American magazine, decided to write an article on the aquatic theme too. But rather than write about the symposium Peter had organised or any of the excellent science that was discussed at the meeting, she decided it was more important to publicise a satirical blog post some layperson had written, parodying the idea with a sneer about space apes. This was a very disappointing response to what was really an inspirational event. It must have been devastating to Peter, but his reaction was defiant. he would write a book. The Waterside Ape is a beautifully produced, colourful and glossy volume. It's academically authoritative and yet succinct and easy to read. Its 220 pages provide an up-to-date summary of the latest science about this fascinating idea. I think Peter's wonderful book was the perfect retort to the very narrow-minded, and one has to say ignorant, attitude of a lot of paleoanthropologists to this idea. At the book launch, Sir David Attenborough put it perfectly. He said, "It's quite extraordinary how professional anthropologists have dealt with this idea over the last 50 years. They've dealt with it with venom." So, thank you, Peter, for doing all this for us. As you can see, considering Peter's history, it's obvious why he was one of the first people I asked to give one of our What Talks. For anyone here who's here for the first time, we run monthly free virtual talks about waterside-related ideas about human evolution. If you like, WHAT stands for Waterside Hypotheses, Aquatic Theories, and this is the 9th in the series. Peter was keen to participate from the beginning and made important contributions to our first two. Originally, he was going to do a talk in April, but this was later switched to today. I must admit, as the date was getting closer, I was getting increasingly concerned as Peter, usually so punctual in responding to emails, suddenly stopped replying. You can imagine then the great shock when I came across a tweet from the Oracle Cancer Trust on June the 9th, announcing the passing away of their founder and chairman. The first reaction I had was to cancel the event, but after some consideration and advice from people in our group, we decided to continue and hold the meeting in Peter's honour. I'm sure he would have wanted us to give our close attention to those subjects he specialised in, the paranasal sinuses and surface ear, more technically known as external auditory exostoses. So, this is the plan. Firstly, we'll see a recording of Peter's talk that he gave at the London symposium that he organised. And on that point, I must give special thanks to Margaret Ejegbai, who helped organise the conference. Margaret kindly sent me a copy of the video. We wouldn't have been able to see it without her help. Then I'll show some short clips of the contributions Peter made to the discussions in our first two meetings at the end of last year. I think that'll take about 40 minutes. As we're watching, I hope people will note down any questions and comments they might have about the paranasal sinuses and surface ear. Although tragically Peter can't be here to answer any questions, a few of us, hopefully including Mark Verhagen, if he's here, might be able to help out. I must admit, I only had the pleasure of meeting Peter once in person, and that was at the London symposium he organised. He seemed a most gentle and lovely man, and I'm sure his wife and 3 children will be missing him greatly. If anyone here knew him better and would like to share a few thoughts of, or maybe a short anecdote about him, that would be wonderful. Finally, I'll leave it to Peter and friends to have the last words of this meeting. I'll play the excellent promotional video he produced for his book launch in 2019. So, without further delay, let's go back 9 years in time to 2013 and return, at least virtually, to London EC4 and listen to Peter's talk, Surface Ear Provides Hard Evidence for Man's Aquatic Power.
Well, my talk is a little different, going back to diving, I suppose, but as an ENT surgeon, there are certain things that we find curious in our practice, and one of the things that has intrigued ENT surgeons for some time is a condition of the ear called exostoses. Now, it's now known as surface ear, mainly because of the explosion on the interest in surfing and swimming. So what is it? And in this advert, how do I prevent it? And this is found from the website on surface ear. Well, surface ear is a common problem seen in ENT departments. And it was first recognized in 1893 by an ENT surgeon called Field. And what are the symptoms? The symptoms are deafness and blockage of the ear canal, and also eventually these patients do tend to get recurrent ear infections. And the curious thing is that this condition is only seen in frequent swimmers. And when we examine the ear, we see that the ear canal is blocked by some curious bony swellings. And these are called exostoses. Now, if we look at the human ear, there are three parts. There's the external ear canal, this is the ear canal, this is the middle ear, and this is the inner ear, which is two parts to it. There's the cochlea, which is the hearing part, and the vestibular labyrinth with these semicircular canals, which is related to balance. Now, if we look down at the ear canal, at the eardrum, you can see that the eardrum appears to be very thin. It's gossamer thin. And you can see the malleus bone is attached to the middle of the eardrum, and through the eardrum you can just see the long process of the incus and the stapes. So through the eardrum you can see these little bones, the three bones, the malleus, the incus, and the stapes. So it is very thin. And in exostoses, or surface ear, what we see is this, that you can no longer see the full eardrum, and you've got these bony swellings, which there's one usually at the back, one at the front, and one at the top. And you can just about see the eardrum through the middle. And this is a progressive condition that may take a few months or a few years, depending on how frequent the patient is swimming. So it is curious. This is another example. But what are they for and why? In the general population, there's an incidence of about 2 to 7%. In frequent swimmers, it goes up to 43 to 64%. In swimming instructors, over 80% of them have exostoses, but it's never found in people who don't swim frequently. So this is the curiosity. And why do they only grow in the deep part of the ear canal, just lateral to the eardrum, and they only grow in 3 constant sites: the posterior one, the anterior one, and the superior one. And no one has really been able to understand or give an explanation of why this happens. And the other important thing is what, from an evolutionary point of view, what is or was the function of these swellings, these incongruous swellings that we see. And as Stephen Jay Gould said, that remnants of the past that don't make sense in the present terms, the useless, the odd, the peculiar, the incongruous, are signs of history. And these are clues that we must use to try and find what these things were for. This is another diagram from the internet on surface ear, and this shows where they grow at the deep end of the ear canal. The ear canal, I just explained, is about 2.5 centimeters long, and the lateral part, the outer part, is cartilaginous, but it's a tubular structure, a cylindrical structure. This part is cartilage, and the inner third is bony. And if we look at CT scans of the ear, this is a side-on view showing the ear canal and a normal ear canal. But But this is an exostosis where the ear canal is almost completely occluded. This is a view from the side. You've got a nice circular normal ear canal, and here you've got exostoses that's blocking the ear canal. This is the jaw joint, the top of the jaw, and the jaw joint, which is just in front of the ear. Now, the various proposals have been made to try and explain exostoses, the genetic factors. In Australian Aborigines, Roach in 1964, in the Peruvian and American India, and eventually Okamura fairly recently looked through all the reviews and really concluded that there was not really much of a genetic reason for developing. But it's generally accepted that it's due to cold water exposure. Animal models demonstrate new bone formation in the deep canal, stimulation of the surface periosteum to form lamellar bone. And Sir David and Geoffrey Lakeman referred to Don Harrison, who was my teacher during the early 70s in London, and he was a great anatomist. And in fact, he did his MS thesis on exostoses. But even he couldn't conclude as to why they were forming. So the precise mechanism and stimulation is uncertain, and this by great David Kennedy in 1986. And so when I was a student or learning ENT, I heard about the Aquatic Ape theory and the writings of Elaine Morgan, and I became interested. In fact, I was asked to write a chapter in a textbook on physiology and anatomy of the skull base and the sinuses and the nose. And it was because of that that I started looking at the references and started looking at about the ears and about the sinuses and why the sinuses were. And that developed my interest. And there were several things that were curious that didn't seem to be characteristic of humans as a terrestrial mammal. There's ear exostoses, the nose, the nasal valve and nasal skeleton, the sinuses, expansion of the sinuses, and a unique development of the ethmoid sinuses in man. The throat, ability to use the oral airway for rapid inspiration of air for diving, and the laryngeal adaptations for speech, where we heard a brilliant talks earlier, especially Geoffrey Lakeman's on the larynx. And I must say that Geoffrey has been an inspiration to me. I visited him in New York some 20 years ago and saw his wonderful work there. So these features, I thought, were much more compatible with an evolutionary period of aquatic adaptation. And anyway, I wrote a paper in 1992 on the paranasal sinuses and other enigmas, an aquatic evolutionary theory. And later that year, Sir David, as he explained, got together a number of people who were interested in the aquatic ape, and Elaine Morgan, and Michael Crawford and Mark and others were speakers at that conference in 1992. But at that time, it was rather ridiculed, and this was in fact an article on the front page of the Times that week, how Apeman kept humanity in the mainstream. And even the following week, Bernard Levin, a great satirist and satirical writer, came in to join plunged in with The Missing Link, C'est Moi, and he sort of castigated all our theories and said it was a load of rubbish. And He said evolution depended 5 million years ago on a sufficiency of swimming pools, a reference to the swimming and the swimming instructors. So if we look at some of the aquatic and semi-aquatic mammalian adaptations in hominids, we've heard a lot about diving, and I was fascinated to hear Erica's talk on that. But the problem is that in mammals, you've got this delicate tympanic membrane, which is fairly easily ruptured. Any impact, a blow on the ear, or diving can cause perforation. And so in a diving animal, aquatic mammals, and we look at the cetacea, the ear canal is permanently closed by a keratin plug. And it went into the sea many millions of years before we stepped into the coastal waters. And their sound mechanisms was adapted to sound transmission in a permanent aquatic medium. And they develop sensory or sonar mechanism. We've heard about the mound at the front, the melon, for sensory perception, for communication, navigation, feeding, socialization, and breeding. So these are adaptations for mammals that are permanent aquatic, in a permanent aquatic existence. And I looked at some of the possibilities for the semi-aquatic mammals. And if you look at these, you find that the ear canal is temporarily or partially closed. They need to hear on land and also when submerged, but they also need the protection of the eardrum. And animals have developed, or mammals have developed, curious different mechanisms. The platypus has a skin fold which protects the eardrum. The Phocidae have angulation of the ear canal when they submerge. The hooded seal, in fact, has an exostosis that develops in the floor of the meatus. The hippopotamus, the ear canal contracts, and you get a glandular swelling in the desman. And I thought, well, why not in hominids, if they were diving mammals, why couldn't the exostoses be an explanation for this? And when we had this, the conference, I sort of suggested that it may be associated with diving. And the hard evidence was just that all these other changes that were associated with the aquatic ape, the subcutaneous fat, the sweat and tear production, these are all soft tissue things that won't be preserved in fossils. But this potentially, exostoses, because it's a solid bony object, this potentially could be a permanent or hard evidence in early man to show whether there was evidence of diving. Again, some exostoses shown on CT scanning. And I spoke to Fred Spoor, who's the professor of anthropology at UCL, and he's got a fantastic collection of CT scans of early fossil skulls. They are very difficult to see what's going on because the ear canal does get filled with rubbish over many millions of years. But in archaeological populations, there have been a number of publications which have shown exostoses in 300 to 600 BC, then back to 1500 BC, Egyptian mummies, and more recently, there have been described the bilateral exostoses in Neanderthals from the Shanidar and Chapeliosa males, and also in the early Pleistocene Homo erectus in Lake Nadutu in the Olduvai Gorge, and this is a publication of Reitmar in 1990. But it is difficult to analyze these, and because there are only a few skulls that can be looked at, it's difficult to get much evidence. But the evidence is slowly coming, and hopefully, as new skulls are found, there will be more evidence available. Now, when I present that first paper, I didn't really understand why they developed in the deep part of the ear canal, why they were in 3 different sites. And so I looked at, try and find a reason. And I'd like to propose a possible method or mechanism of exostosis formation. If we look at the growth of long bones, the growth is from an epiphyseal growth plate, which is situated near the end of one end of the bone. It only grows from one end of the bone. It's composed of cartilage, and new bone forms at the growth plate, and the bone gets longer and remodels as it goes. And so if we look at the sequence here, as the growth plate, new bone forming, remodeling, more bone growth, remodeling, and as it goes on, the bone gets longer. Now, you can get abnormalities of the epiphyseal plate, and we know the condition of achondroplastic dwarfs, where there is a reduced growth of the epiphyseal plates. So these people, their long bones don't develop, or they don't lengthen, and so they have short stature and short arms. But there's also a curious condition called hereditary multiple exostoses. It's a rare genetic condition where there is increased growth stimulation of the epiphyseal growth plates. Here, around the knee, the growth plates in the femur are at the bottom end, and the growth plates of the tibia and fibula are at the top end. And so you get these exostoses that develop. And I thought, well, why couldn't this happen in the ear? And if we look at the ear, it's a cylindrical tube, and in fact, the ear canal is not just one bone; it's 3 bones. There are 3 plates of bone that make up the wall of the ear canal. There's the squamous bone, which is the top part. There's the tympanic bone, which is this part, and the mastoid bone, which is posterior. So they grow. The epiphyseal plates, the growth plates, are at the medial end of the bone, and so the growth takes place from there outwards. So there's the 3 plates here, and the 3 growth plates are all near the eardrum, and growth is outwards, away from the eardrum. So I thought, well, this could be the site, or the reason why the exostoses develop in these 3 sites. And the exostoses correspond to the sites of epiphyseal bone growth, the 3 plates, as we see here. And there's some recent work being done on what happens to on a microscopic scale with fractures, microfractures, and also cold water stimulation. And I won't go into the physiology or the pathology of it. It involves the osteoclasts, which actually make the bone, the stem cells and stromal cells. But essentially, what happens is that at the epiphyseal growth plate, the periosteum has good blood supply, and with cold water stimulation, it causes hyperemia, which is increased blood flow over that area, increased osteoblastic and activity, which are the cells that make the bone, forming new bone and remodeling, and you get release of various factors, the interleukin and bone-derived growth factors. And so, as a result of exposure to cold water, the epiphyseal growth plate overgrows and forms this exostosis. So that, I thought, was a reasonable explanation for it. And the formation of the exostoses would protect the delicate eardrum from excessive pressure during diving, and the small residual opening in the middle would allow sound to be transmitted when on land. So a certain amount of sound could get through there, but the force on diving would be eliminated on the eardrum, or at least drastically reduced, and that would hopefully protect the ear. So I thought that was a reasonable explanation for exostoses. So I also looked at other ones, and briefly I'll just mention some other Ent aquatic adaptations. The nose, as we've heard before, seems to give a protected streamlined structure for diving and swimming. And also, in different to apes and chimpanzee, the nasal opening point is points inferiorly downwards rather than forwards, as in apes, because if an ape dived, it would be inundated with water. And if we look at the shape of the skull of a gorilla and man, you'll see that this is modern man, but it's much more delicate and lighter and much more buoyant, one could say. And part of this reason is because of the sinuses. And if we look at the sinuses in man and ape, in ape there's no frontal sinus, the orbits are close together, it's got a narrow nose, and also the first incisor is much bigger than the second. But in hominids, you've got a varying size frontal sinus, wide orbital distance between the two orbits, and this space is filled with these ethmoid sinuses. And these ethmoid sinuses are unique in man, and one possible explanation is that this helps to create a more buoyant skull for keeping the airway above water, and the first incisor is much the same as the lateral incisor. So it helps, I suppose, to keep your head above water. And this is, in fact, one of Jeffrey's sides that I pinched with the migration of the atlanto-occipital articulation from a forward-projecting skull to a vertical skull. Another curiosity is the nasal valve, the ability to close off the airway when submerged. And if we look at various aquatic mammals, there's a valvular mechanism in the cetacea, newts, crocodile, seals, polar bears. And in others, in penguins, they can close off the laryngeal aperture when diving. And also the frog, coincidentally, has a specialized subnasal pad which closes off the airway. In man, is the only higher primate that has the ability to flare the nostrils, and the delicate dilator and constrictor nares muscles are not present in other primates, but these help to flare the nose and to constrict the nose. And again, this is unique. And so, in conclusion, protection of the eardrum in a semi-aquatic man offers a very plausible explanation for the formation of exostoses. And the presence of exostoses in archaeological populations confirms that they were frequent swimmers and divers. And possibly in early hominids, they wouldn't be swimming just for social reasons, but they would be swimming for diving and hunting and feeding, and ultimately for survival, which is what evolution is all about, to give some advantage. And I think that William Shakespeare was rather prophetic. This is from The Tempest. Nothing of him that doth fade, but doth suffer a sea change into something rich and strange. And finally, this little gem: when we were medical students, one of the first things we were taught is that if you're using a stethoscope, always make sure that you warm it first. Thank you very much.
That's so sweet. I'm going to go straight on.
For those who don't know, I'm an ear, nose and throat surgeon, and I took an interest in this about 35 years ago when I read Elaine's first book, and I met up with Elaine and we discussed various ideas. I've sort of concentrated on the head and neck aspects, but with regard to fossil evidence, I thought that there's one condition of the ear called exostoses, that are bones in the external ear canal, which ENT surgeons have known about for over 100 years, but no one's ever been able to explain what they are. And the thing is, the curious thing about them is that they are only ever seen in people who swim and dive on a regular, almost daily basis. And I wrote a paper in 1992 suggesting that if we were able to demonstrate these exostoses in early human skulls, it would provide the vital fossil evidence. And anyways, subsequently, as you all know, these exostoses have been found from 1 to 2 million years ago in Homo erectus, and a recent paper has shown that 47% of Neanderthal skulls that were examined had these exostoses, confirming this was the vital fossil or hard evidence that Desmond Morris and others have said was lacking. And you've got Alice Roberts, Chris Stringer, who've written lovely textbooks and brilliant programs on evolution, but as you say, they don't actually mention the aquatic ape. But people have just ignored this vital fossil evidence. And this is something that I was going to talk about in due course next July. But you know, in your talk, you mentioned about finding Lucy in a wetland, but the vital thing is not what fossils they're associated with. This is actually fossil evidence actually in the skulls of these early Homo erectus skulls. And it's conclusive evidence. There's more and more papers on these exostoses, and in fact they're found, more recent papers show that they're more common in males than female skulls at that time, suggesting that it was the males who were doing most of the hunting. And if you look at modern sea divers, free sea divers that hunt for a living, it's the males who usually go for longer and deeper, and the exostoses are more common with them. But I think that one should perhaps mention these exostoses as vital fossil evidence, but no one seems to follow that up. People ignore that. Just a little point about the hairlessness. As a head and neck surgeon, I do a lot of surgery in the head and neck region. And the one thing that is remarkable is that the only bit of the body that has the subcutaneous fat is below the eyes and the nose. If you look at the scalp, and if you if you're dissecting or doing surgery on the scalp, it is like a pelt, like any other terrestrial mammal. It is quite different to the rest of the body because it's not immersed in the water, whereas the rest of the body is immersed in the water, and that's why we have developed these the subcutaneous fat, the streamlining, the buoyancy, but the head remains the same because it is not immersed in the water as frequently. Obviously, with diving, it is, but not all the time. And what I've done is, for the first time, is look at the fact that we are just an animal, like any other animal. We're nothing special. And our physiology, our anatomy, our metabolism is the same as any other mammal. And I've just worked from basics upwards and have tried in the book to explain hairlessness, subcutaneous fat, the descent of the larynx, which I feel is an exaptation, which evolved because of breath holding. And if you read a chapter on the evolution of the human larynx, the only reason that something elongates, like the back of the tongue, doubles in length in a vertical direction, for what reason? The only possible reason from an anatomical and physiological point of view is that that part of the tongue was pulled down by traction, and that doubled the length of the base of the tongue. And that is because of the negative pressure in the chest, with a negative pressure in the trachea, the larynx, the hyoid. They are all connected. And the base of the tongue is muscle, and therefore that can stretch. And it was the negative pressure in the chest. If you look at divers, and Erica has looked at these, the negative pressure in the lungs on diving to 20 meters, the lungs reduce in size by about a third, and a tremendous negative pressure pulling down the trachea, and that is what elongated the base of the tongue. And so that was why I think the base of the tongue doubled in length in a vertical direction. And it was only in the last 100,000 years, during the intellectual phase, that speech developed because of this exaptation and the difference in the position of the larynx. That is just my view. Simon, congratulations on your talk. Just a quick point about Vernon's comment. I think in addition to the feminism, the other main criticism of Elaine was that she was a scriptwriter and she wasn't professional scientist. And I think a lot of people, critics, also said that about her. And but we know that she was, she had all these ideas, and every credit should go to her. I'm also an outsider as an ENT surgeon, but I've looked at evolution from a medical point of view, from the physiology and anatomy point of view. And I think it's all very well talking about psychology of what's happening now, why people are not talking about it. But when Desmond Morris, in his Naked Ape book, which was published in 1967, he was about the only one who looked at Hardy's theory and said that it answered all the questions But the only thing that it didn't have, which all the other anthropologists and archaeologists depend on, is fossils and fossil evidence. He said, we don't have any hard evidence, i.e. fossil evidence. And I've discussed this, I got involved in the mid-80s, and I was fascinated by Elaine's book. I was looking at the anatomy and physiology of the skull and head and neck area, and I discussed things with Elaine at that time and wrote my first paper in 1992. And as an ENT surgeon, I recognized that there was one fossil evidence that we could find, and that was the exostoses in the ear canal. And I don't know why people have ignored that, because the exostoses is something that ENT surgeons have known about for over 100 years, but no one's been able to explain it. The fascinating thing is that it is only found in people who swim and dive on an almost daily basis. And now it's been found in Homo erectus 1 to 2 million years ago, but also a recent paper showing that 47% of Neanderthals had exostoses, and these are more common in males than females because they did more of the hunting and therefore more of the diving. But this is hard scientific evidence. And also in my book, because also I felt that our papers were being rejected, and following I organized a conference with David Attenborough in 2013, and Mark and others were there. That was in London, on human evolution, past, present, and future, trying to open the debate to put both sides of the argument. And again, it was ridiculed. But after David Attenborough's program on BBC in 2017, when he was ridiculed for wasting BBC time, I was really upset and thought that the only way of getting it to the public was by writing a book, which I did. And unfortunately, with COVID, 90% of news items are about COVID and the pandemic, and no one's interested in really a controversial theory of evolution. But I think we've got to try and get the facts. And in the book, I have worked out about the descent of the larynx, why, from a medical and anatomical and physiological point of view, the larynx descended, about the skin, about the color of the skin, about hairlessness, about big brains. And also another thing that I found is that humans, unlike any other terrestrial mammals, have a marine type of kidney. It's quite different from any other terrestrial mammals because we evolved in a saline environment, rather than ordinary water. And all the shallow lakes in the East African, the Great Rift Valley, they were saltwater lakes when the Great Rift Valley formed, about the same time as the evolution changes took place. And the sea inundated from the Gulf of Aden right down to Mozambique. And these are all saltwater lakes. And that is where virtually all of the early Australopithecine fossils were found.
Okay, so I think we can all sense his frustration there. It was so sad, isn't it, to see that and to hear him talk about him giving the talk today. You know, he was planning to do that, and it's very sad to hear that. So I don't know if has anyone got any questions or comments they want to make, either about the topics, so paranasal sinuses and ear exostoses, or perhaps share any thoughts or stories or anything about Peter? I'll open it up. Who wants to go first?
Yeah, I'll have a question. So
All right,
if you intend to swim a lot, if you then wear earplugs, would that stop the exostoses growing?
Well, that's my understanding. Yeah, I mean that is the recommendation to people who go in the water a lot to wear earplugs, and that does stop it. So I think Peter showed that slide. How do I prevent it? And I think the answer is quite straightforward. I don't know, Mark, have you got anything to add to that? Mark Verhagen here is a GP and is also very interested in this idea. So I don't want to pretend that I know anything, but Mark, do you want to sort of say anything more?
I don't know much about it either, but I was wondering what is the importance of cold water. They sometimes speak that it's only cold water that causes ear exostoses, and I don't know what does it mean. I would have asked Peter, of course, but I think that is interesting to know where did our ancestors dive. Did they dive mostly or only in cold waters? And does ear exostoses also develop in warm waters? I don't know, and I would like to know, but Peter can't tell us it anymore.
Erica, you did a very interesting talk a couple of months ago about the effect of the water on the forehead. Do you know anything about ear exostoses as well?
Well, I can comment on the ideas that you could close off with an air plug, and you cannot, because as long as you have any air trapped behind the air plug, you will damage your ears if you try to dive with an air plug. And the point is that they have developed specific air plugs with a small entrance, a small hole where water can enter into your eardrum. And people that often get ear problems like infections and so on from frequent diving, they tend to like to use this kind of air plugs, and they look more or less like these exostoses with a little hole in the middle. And I think the point is that you don't get new water into your eardrum where it causes a chilling. Also, warm water, 20, 25, 30 degrees is colder than your body, of course, so it will chill you down. And I just speculate that the function of the exostoses could be to do the same thing as such an air plug. But you have to remember that you cannot seal off the air with an air plug and leave the surface. You can only swim with it. And the whole point of going in the water is diving for food. So I wouldn't say that you can do away with it with normal air plugs. It's a bad idea, because you can get reversed squeeze, what is called squeeze, when you have an air plug and the volume of air trapped behind it shrinks. You will pop your eardrums the other way coming.
Yeah, when I mentioned that as a solution to the problem, it was specifically surfers. I watched a couple of videos of surfers, and obviously they are at the surface. Is there a depth dependency though? I mean, how deep would you have to dive before earplugs would cause a problem?
Well, a few meters would be enough. It depends on how rigid the plug is and if it can still move into your ear, and if it's stronger stuck in your ear canal, then your eardrum is elastic. So it depends on a lot of things, but I would say you can't dive to even 4 or 5 meters with a solid plug in your ear. You would risk to damage your ears. But talking about some other things with the theories from Peter, this long vertical part of the tongue, it was something I commented on in my talk a month ago. And I don't think it's a suction of your base of your tongue when your lungs shrink when you go to depth. If you go to 20 meters depth, for instance, they shrink to about 1/3 of their original volume. I think you actually need to use your tongue for being able to equalize at such depths. And you actively use the base of your tongue as a pump, and you can seal off different parts of your airways using the glottis and the vocal cords and the false vocal cords and your soft palate. And you have to be very actively working with the back of your throat to be able to dive. And this is very little understood by most people that discuss also human diving. But it's very, very common to have courses in how you use the base of your tongue to do different things when you learn how to free dive. And I suggest that you, as I advised in my talk, that you Google and find courses of how to equalize when you free dive. Then you will see all kinds of examples of how you have to develop the lower part of your tongue and how you probably couldn't do that if you had a short and flat tongue. So I think Peter had the right idea that our tongue is specialized for diving, but it's much more to it than just passively being sucked into our lungs, more or less. We are using it to divide the air between the head, where we need to equalize, and the lungs, which we also have to protect. And you can also use it for lung packing, that you overfill your lungs before diving down so that you don't hit the very low volume where you can have squeeze. But it's a long story. I could talk about it for half an hour, but I suggest that you see some videos on it instead.
Yeah, I mean,
And then
that was I mean, I remember from your talk that was fantastic. But the thought that always crosses my mind about that is, how deep would you need to dive for that to be useful? I would have thought if you're just diving in the very shallows, you know, literally a couple of meters at the most, do you really need to have all that sort of adaptation?
It is more important that you have all these things in place if you dive down deeper than 10 meters. But looking at the Bajau population and the Ama, they regularly dive 15 to 18 meters. So, I mean, the food is very abundant and in the deeper water, because you easily pick it in the shallow water first, and then the divers want to go a bit deeper. So if you are living in a place close to the shore, it will be depleted from food in the first 5 meters very soon. And that would have happened a long time ago as well. So I wouldn't see why we could manage with just diving 1 or 2 meters. Then we could as well pick the things with our hands or our feet, you know.
That's a good point. Can I open it to somebody else? Does anyone else like to make a question? Francesca, you've got your hand up, and then Mark. So Francesca next, please.
Okay, well, it's not so much a question as an observation. I just thought it was interesting to note what Peter said about the ear exostoses in Neanderthals at 47%, and that he said that most of those were male as well. Well, that suggests perhaps that almost all male Neanderthals had them, which wouldn't and implies then that all male Neanderthals dived regularly. And compared to the modern population, where it's something like 7 to 8%, he said, general terrestrial population of humans today. So I just think that's interesting to note, that it does sort of indicate Neanderthals were more aquatic than we are today. And he also mentioned Homo erectus, of course, not so many cases perhaps, but 1 to 2 million years ago, a few examples. Okay, possibly Homo erectus was not so much in cold water. We don't know that, but Neanderthals did a lot of diving in cold water. If they did, it must have been Atlantic, you know, it would have been colder than Indonesia, for example. That's all I just wanted to...
Mark, do you want to come back on that? Because you had your hand up.
Well, about laryngeal descent, I think we are forgetting that they probably ate underwater, and they swallowed and they sucked food underwater. And that's one of the reasons I think that of why the larynx descended. Japanese author that who described laryngeal descent in humans, and it's there are 2 different parts of laryngeal descent. I can't reproduce it now, but I think you can find it in one of my articles. It has probably also to do with speech, laryngeal descent, but that came later probably.
Mm.
But
But
about
Mark-
the ear exostoses, I also wanted to say that humans have very frequently earplugs, earwax in the ear that completely closes the ear canal. And I have a lot of patients who I have regularly to cleanse the ear canal. So probably, not unlikely, most of our diving ancestors, the ear canals were completely closed, not only by ear exostoses, which we can see in the fossils, but also by earwax alone.
The problem is, of course, you don't hear very well, and we were supposed to talk some kind of vocal language. I don't really see how it fits together at the same period.
Came later, huh? Language came later, very likely. Neanderthals were probably still diving frequently, mid-Pleistocene, Homo erectus early Pleistocene, and we became waders and later, still later, walkers, perhaps only 200,000 years ago. I think many of us placed this aquatic phase much, much too early.
I think it has been many phases, very early one, and then we have this retreat for several periods. That's my view of it, that it was very, very early to begin with. But anyway, with the, yeah.
I'd like to bring
With-
in Charlotte. Charlotte had a hand up. Could you like to go, Charlotte? Hello. Welcome to the group. Do you want to
Thank you. Yeah, I was wondering about Curtis Marion and what's happening in Pinnacle Point in South Africa, because he sees that Pinnacle Point as a refuge site, you know, refuge population, and the vegetation being very specific to very high and a very high concentration of tubers, which would give a very, you know, is unusually high in that area, the Fynbos ecological sites, you know, but also he sees it as a way, you know, that was where the Aguilas current and the Benguela current sort of collide at that point. And so therefore it never really got really cold in the ice age, so to speak. And, you know, when the Sahara expanded, the Pinnacle Point was the place where they got pushed to. And they're finding a lot of seafood remnants and, you know, in the caves around there. And that I think he puts it at about 170,000, maybe as early as that, you know. But it'd be interesting to see how that ties in. And also he says when it became really cold, then that part of South Africa became like a huge plateau the size of Wales, I think he said. And therefore all those animals came because you had like a savanna type environment. And then when it got warm, the sea came up and then, you know, the savanna went away. So there's that little bit of thing to tie into what we think. You know, I don't know how these two things join up, but there's something I was thinking about.
Yeah, thank you, Charlotte. I must admit, I've been watching those papers from Curtis Marion myself, and there's a whole suite of papers, isn't there? There's some that are genetic as well, genetic papers which show a sort of a movement via South Africa, via the Okavango Delta, and then a big migration south to South Africa. And I think it's true to say the earliest unequivocal evidence for modern Homo sapiens is on the coast of South Africa or thereabouts, around 167,000 years ago. And that's always struck me as being really important evidence. So when we're talking about is the more aquatic phase early or late, I'm more with Mark. I think it's late, and I think it's maybe even later than Mark thinks. I'm of the view that Homo sapiens is still pretty aquatic, and I think that's what you know, Erica maybe said last time. Gareth, do you want to have a go? You got your hand up.
Just a quick one. We could talk about Peter's work and the aquatic ape and all the recent discoveries that keep going on. I just wanted to say a few words about Peter as a man. I was honoured to be asked to attend his book launch to introduce David Attenborough. And what made the biggest impact on me was the affection of the people there for him. You said yourself, you called him a lovely man. And I remember talking to Richard Collins, the producer of the Attenborough radio series. And that was his exact phrase. I was asking him about Peter. He says, a lovely man, a really lovely man. And what better epitaph could you have? When there was a little interview at the beginning, they had the cameras there, and me and Peter and David stood in a line, and Peter said something, David Attenborough said something, and then here comes Nigella Lawson, arriving late, walked through all the crowd, through the cameras, and just flung her arms around his neck. Because we mustn't forget, he was a cancer specialist and a ear, nose and throat surgeon. And a lot of the people that would come to celebrate the launch of his book were eternally grateful. He'd saved their lives or the lives of their family, their children, their husbands and wives. I got to meet his brother and his wife, and their affection for him was remarkable, although they clearly used to tease him something rotten about his obsession with aquatic theory. But if you know, that's his epitaph, a really lovely man.
Well, thanks so much, Gareth. I really appreciate that. I was so hoping that somebody could come and add a personal touch to this, because I feel terrible. I only met him for a very brief few moments at that conference. Has anybody else got any memories of him that they'd like to share? Anybody? Mark, what about you? Did you meet him at all?
Well, yes, but only briefly and very long ago, so I don't remember much about it. It's too long ago. About Edinburgh.
Okay, Andrea, do you want to say a few words?
Yes, well, basically, I met Charlotte at the conference in 2013. And both of us had seen, I think Charlotte had seen the conference advertised in, because she was a midwife and working around the Royal Marston area. So that's how she saw about the conference and her interest in it. And I was a swimming instructor, and the aquatic ape ideas were just fascinating for me as a swimming instructor. And so it was immensely important to me. Charlotte's a really great friend, and we talk about Peter's ideas and lots of other people's ideas. So yeah, we feel very grateful, and we did go to his book launch as well. Yeah, it was lovely. He was very warm and pleased to see us. Yes, it was lovely to see him.
Oh, thanks a lot, Andrea. I mean, I just personally feel very guilty because he went, we saw in that last contribution, I think it was the second meeting, he said that he can't understand why nobody talks about ear exostoses because it was such hard evidence. And I must admit, I'm guilty of that. On many occasions, I've been talking about this thing, and I kind of tend to neglect that myself. And so I certainly won't from now on. But he's done so much great work. The other thing that we talked about that we haven't discussed yet, I don't know if anyone's got any thoughts about paranasal sinuses, because that's another big thing. And it always strikes me that it's the thing he chose to put on the front of his book. So when you see the book cover, you think, well, what's that got to do with the waterside theory? And of course, it's the paranasal sinuses. And it always strikes me that's kind of an important thing about the buoyancy of the head, and these little air pockets around the nose mean that the face is going to be lifted towards the surface if you're in a near drowning situation, and that could be a lifesaver. And I've always wondered what the situation is with infants. I understand that infants have the ethmoid sinus quite early, but the frontal and the maxilla are very late to develop. But from my anecdotal experience of having 4 kids, and seeing them as chubby babies with big fat cheeks, I don't think they really need to have the air pockets so much as just having the fat, kind of keeping them floating. But it's interesting, isn't it? I don't know. Has anyone got any thoughts on paranasal sinuses? Please go on, Mark. And then
well, I could say a bit on sinuses in Homo erectus. Homo erectus had quite small paranasal sinuses, and they were bigger, if I recall correctly, in Neanderthals than in humans, but they were smaller in Homo erectus. And I guess it is because Homo erectus dived in more in salt waters, and they had to the main weight, what's the term in English? They had to be heavier than diving in fresh water. So there are other indications also that the bones of erectus were heavier, a lot heavier than in humans. So probably the Homo erectus mostly dived in salt waters, as far as we can see, and then later they became Neanderthals dived also in, but more in fresh water, and we still, I think the evolution was from salt water then to Neanderthals possibly followed the rivers they are found at that season in river valleys. And I guess they followed the river seasonally to the sea. And then the evolution, still later to Homo sapiens, was that we early sapiens became waders more than divers. That is the general sequence of what happened, I think. The early hominids were aquarboreal, we say. They were waders in swamp forests. They climbed almost overhead and they waded a lot. And then the evolution, probably early Pleistocene, was from aquarboreal to diving. Homo erectus was a real diver on the water. They did nothing more than diving, I think, the whole day. And then later, Neanderthals were entering the land along the rivers. And then the late Pleistocene evolution was from more wading, and we still less wading and more walking. That was the general.
Okay, Mark.
And that explains why Homo erectus had small paranasal sinuses, and they were bigger in Neanderthals and in humans.
Okay, thanks, Mark. Okay, we've got Gareth, and then I think Erica had a hand up, and I think then we should start to wrap it up because we're going on a bit longer than I was hoping. So, okay, Gareth, do you want to go next?
Just a small contribution about the sinuses. I discussed this with Peter when he was writing a book, and he hadn't come across it. It turns out that our sinuses produce large volumes of nitric oxide.
Ah, yes.
And this is something that then dilates our blood vessels. So there could well be a diving aspect to that. And it's in Peter's book.
Yes.
So he included that. Oh, and if you want to produce more nitric oxide in your sinuses, you should hum.
Hum.
Humming generates lots of nitric oxide in your sinuses, which then go into your lungs and then into your bloodstream and improves your circulation. Shall we all hum a little tune?
And inhaling through the nose.
Right.
Erica, do you want to finish off? Do you want to say one more thing, and then I think we should close?
Yeah, it will be a kind of disappointing way to end, because I have much problems with the sinuses in the head combined with diving, because they provide another place, another space where you can have squeeze. And it's quite common if you dive down a few meters only, that if you have a little bit a cold or a block of the sinuses, they have a more open standing tube connecting them to the lower throat. then you have a terrible headache, and you cannot actively push air into the sinuses very easily. So I am still struggling with what they do in our head if we were really adapted to diving. They might be there for a completely different reason, I think. But it was very interesting what Mark said about the small paranasal sinuses in the Homo erectus that he considers to be the most diving early form. So maybe they were trying to do away with them to be able to dive very efficiently. So this is a kind of a mystery, but of course they provide more air in the head if you can direct it to where you want, or if you have a kind of sponge structure in the sinuses that can swell when you go down, then you could use the air for other purposes or something. That's happening in some marine mammals. Oh yeah, that is one problem, but also with the light floating head. Of course, if we fall in the water, our face will usually go under. So sinuses or not, we cannot keep our airways over the water with the help of something that is in the top of the head. We need to float on the fat on our body and on the buoyancy on the lungs to keep the head out of the water when we want to rest, when we want to swim around a little bit and catch the breath. Again, I don't see that it should make it easy. We don't wear the safety jacket on top of our head when we want to be safe when we are in a sailboat. So it doesn't work like that. It has to be something under the neck that makes us float. So I rather tend to think it has to do with vocalization or with something completely apart from that. But it's interesting what Peter said, that we don't have any fat padding on the top of our head, where we don't have water exposure all the time. And this is actually the place we need to warm up to start the diving response. I was reviewing that a little bit in the talk. I will not say anything more about it now. But he was also noting that the fat padding is not present on the top of the skull, which is quite interesting from this perspective and makes sense. This makes sense. Okay, thanks for a nice meeting.
Thank you very much. I'm going to now play the video I'm going to share the screen. So I'm going to play the video of Peter's book launch, which was really beautifully done, and Gareth spoke about it a little bit. But I'm going to play that now, and then I think we'll close. So I'm going to leave the last words to Peter and his friends.
I guess if we start with how each of you first began to get involved in it.
Well, I got interested when in about 1985, when I was asked to write a chapter in a book on anatomy and physiology of the skull, because I've been appointed a consultant and I had an interest in the skull and nose and sinuses, and I just couldn't reconcile the complete differences between humans and our ape cousins who are still swinging around in the trees as they were 20 million years ago. And I thought, we're bipedal, we walk on 2 legs rather than 4, we have subcutaneous fat, we have big brains, completely different heat regulation system. And I thought this can't be because we just came down from the trees onto the savannah and stood upright because we could see further on the grass.
They look around me.
And you took up that thing about being by the waterside and an easy meal, even a pregnant woman could search for that.
Yes, I think the story of trying to trace humanity's evolution has been based on bones, fossil bones. Because we're talking about way back, we're talking about Australopithecines, about little ape-like creatures that were standing up. The notion that we were developed on the savannah has always been there because the people have been looking at the bones. And of course the bones can only tell you so much. And they theory of human evolution is based on birds. When suddenly you've got anomalies to do with the various fats, body, and so on, and the various structures in the throat, and so on, which don't make any kind of sense until you actually sorted out the detail. You, with your expert knowledge of human anatomy, saw all sorts of things that you didn't know.
Good evening, everybody. Thank you all so very much for coming. I'm Elaine Morgan's son. I can't imagine that many of you have not heard about the aquatic ape theory, or you probably wouldn't be here. Just a quick synopsis. As it started, my mother had come across a single eureka paragraph in a book talking about human beings having been more aquatic in the past. The more she looked into it, the more aquatic features she found. Please welcome Sir David Attenborough.
Thank you very much indeed. You should really be hearing from Peter about this book. In my view, I will be brief. In my view, this is a total, uncontrovertible demonstration that our view of the history of paleo history of humanity has been quite misguided. He presents a whole series of arguments: our lack of hair, our subcutaneous fat. I won't list them all because I dare say Peter will. But what I would say is this. It is quite extraordinary how professional anthropologists have dealt with this theory over the last 50 years. They've dealt with it with venom. It is quite irrational, the extreme things they say. And I was pondering as to why this would be so. And I think I know the answer. Paleoanthropologists, human anthropologists, have constructed the history of mankind, and, well, yes, mankind, from 5 million years ago, almost entirely on bones. And that's their people, that's their trade, stock in trade. And using those bones, they've never looked at anything else. When a man who knows about the soft parts comes into this, he produces a whole set of new arguments. If you buy the book, you will find at least 2 which are, to my mind, conclusive. One is to do with the things called exostoses in the ear canal, which develop their bulging growths on the ear canal, which occur amongst people today who spend a lot of time diving. Extraordinary. And they have been discovered in the skulls of the period that we're talking about, human skulls. Another extraordinary revelation in Peter's book, which is also new, is that human babies, when they're born, are covered in a membrane called the vernix. It's a very strange thing. Nobody quite understands why. There is no other primate that we know that has a vernix. Peter and his workers, co-workers, have discovered that there is another creature which has a vernix, the seals. And what is more, chemically, biochemically, the molecule which is responsible and the gene which is responsible for producing a vernix is identical.
Thank you all very much for coming, and thank you, Gareth and David, for those very kind words. I looked at the hearing mechanism of various mammals, some who lived on land, where they need an open ear canal for hearing, others who've taken to the sea, the whales, the dolphins, their ear canals are totally closed off, and they've developed this sonar mechanism for hearing. But the semi-aquatic mammals, who spend part of the time on land, part of the time swimming and diving, they need to hear on land, but they also need to protect their delicate eardrums when they're diving.
And I looked at these semi-aquatic mammals, and all of them had some mechanism to close off or narrow the ear canal for diving, to protect the delicate eardrum. And in fact, the seal has an exostosis. And I thought, if it's okay for a seal, why not for man?
So, to me, this is a very, very important book.
Okay, well, that's it, folks. I'm going to stop it there. So thanks very much for coming, and thanks for all your kind comments and all your help. I'll see, hopefully, some of you in a month's time for the next one. Thank you.
Thank you, Elgis, for organising that.
Thank you.
Yeah.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.